With 2 state-of-the-art facilities in town, Dedicated Dental Service delivers dental care in a really warm and comfortable way.
And Dr. Manuel Bedoya and Mario Bedoya are here to invite us to their family there at the office. Nice to have you guys here.
Thank you.
Thank you.
Pleasure to be here.
It's always a pleasure to catch up with you. So, Dr. Bedoya, I want to start with you because some people have trouble sometimes finding that right dentist for them. So what advice do you have for people looking?
The best advice is an example I had yesterday where this lady had this new insurance plan. And she says, I looked and there's 300 dentists in there. I don't know anyone in that list, so how do I find? So she asked friends. And the friends, luckily, were my patients. So she came in and was very pleased.
It's a personal connection.
Yes.
And it's word of mouth, which is the best compliment that you can have. And some of the advertisements that you have that people are familiar with say implants in 1 day. Is that possible?
It is possible. Now, it's not always recommended because we have to evaluate the bone, the structure, the overall condition that the patient comes in. But as an example, let's say someone was in an accident and hit the steering wheel and knocked out a front tooth, broke the root. We've removed the remaining root structure, placed an implant and a temporary crown, and he walks out with a tooth.
And a great smile at the same time.
And a great smile, and it's that personalized care. I mean, each situation is different. It has its own necessities, et cetera. And so when we're talking about patients coming, say, from another office, their treatment plans may be what they are, but how do you guys deal with that when someone comes in with a plan that's already been made?
Well, we, of course, take our x-rays, do a clinical exam, and oftentimes the 20 items on that treatment plan are not valid in my evaluation. And patients, of course, have a suspicion of that because the first comment is, my teeth don't hurt. You know, this $5,000 treatment plan seems like I should be in pain. And in going through, we find that maybe half or less of that treatment, in our opinion, is valid. There's a lot of dentists, unfortunately, that like to classify stains as decay. Now, they show a stain on a tooth with a mirror with, their internal camera. What does the patient know?
Right, of course.
It doesn't look normal. It's brown, it's black.
Right.
So they, go by what the professional is telling them. So it's best to seek what?
A professional and trusted,
opinion.
and a trustworthy dentist.
And once you've developed that relationship with your dentist that you trust, he tells you that stain is not a stain, it's decay because it's thick, so there's a little radiolucency in the x-ray, then you believe it.
Right. And speaking of dark or different, discoloration, so are black fillings or dark fillings really that bad? Not
at all. I have some. I just had a lady that had amalgam fillings, which is what you refer to, which are silver combination alloy mercury. She's had them for 40 years. And she was a military child, so she had fillings all over the world.
Right.
And she's like, and previous, exams, recalls, asked me, do I have to replace them? And I checked them for fractures, for decay, and leakage. And if there isn't, then
they're perfectly fine.
If it's not broke, don't fix it.
Right.
But unfortunately, a lot of the treatment plans that I see come in with replacing every amalgam that's in there that can be thousands of dollars. And
you guys take the better approach. You take the honest approach. So Mario, let's get you in here a little bit. What's it like for you to work in this family business, and what's the secret behind all the success for all these years?
Primarily hard work. I mean, I've seen my father, obviously, since I was a kid. Just the amount of dedication he has to his business is tremendous, to his patient base. What the comments you were talking about, it's a business, right? So the more you can sell, the better it should be. But kind of like with auto mechanics, you kind of, there's a degree of honesty that has to occur. And again, dentists are like everybody else. Everybody has an opinion, right? And in today's world, it's tough. So they have to kind of survive. So I don't totally blame them. They have their opinion that this is better or not, but Dedicated Dental's philosophy has been always, what does the patient want? This is what we recommend. This is what's best, second best, least best.
Right.
But if somebody who comes in, they just want a cleaning because they're going to a wedding, we'll give them the cleaning. Other outfits, well, no, you need to have a deep scaling first because you got a lot of decay in there. You want a cleaning? We'll explain to you what's going on, but if you want a cleaning, you can have your cleaning.
Give you that cleaning.
Yeah.
That's the secret. Thank you, guys. Thank you for being here. Nice to see you.
Thank you for having us.
Nice to have you here. And right now you can get a free second opinion with consultation, x-ray, as well as examination. For more information, you can visit dedicateddental.net or you can call 520-573-1900.